All right. So Don Hagen says, how long can I take 24 milligrams ivermectin and 10 milligram prednisone for post-vaccine and long COVID joint and muscle pain without serious side effects? I don't know. I wouldn't take prednisone really at all. I know that it's in my kind of generic protocol. I highly recommend people don't follow a generic protocol, but consult somebody directly and get a tailored protocol. But steroids are basically like, what do steroids do? Steroids block the effect of your immune system, and they will make you feel better. They will take away your symptoms, and you'll think that your disease is solved, right? Great, I'm better. But they don't actually solve the disease. All they do is prevent your immune system from solving the disease. So I think I'm actually going to remove, and thanks for reminding me, prednisone from my protocol. And even ivermectin. So ivermectin also has immune blocking effects, right? So if certain interleukins like interleukin 10 are elevated, ivermectin can lower them. Or at least it seems to have that effect in people, right? And that's one of the mechanisms of action that we suspect. On the other hand, ivermectin may also address the underlying root cause by helping you deal with the spike protein toxicity directly by actually getting rid of the spike protein, helping your body get rid of it. So ivermectin is definitely more benign than prednisone, and even possibly vitamin D. So like I was saying before, vitamin 25, supplemental vitamin D in people whose immune system, or in people whose bodies have purposely lowered 25D levels, can have an anti-inflammatory effect and cause it's basically taking your immune system and putting it in jail. And it's like if you had a country that was invaded and you put all your military and paramilitary and police forces in jail and said, sorry, you can't go and root out the enemy that's invaded us. That's basically what you're doing when you take something that is an immunosuppressive medication. And so in the beginning, it's just maybe some spies have entered your country, right? But then over time, they start to multiply. They start to gain more strength and take over more things, and you start to see a problem. So in the beginning, you may not really see a problem, and you might actually see more of a problem if you try to root them out than you would if you just left them alone. And yet you don't want to leave them alone, right? Like you need to get rid of them. You need to kill them. You need to, or jail them or whatever, kick them out of your country. You need to go and solve the problem, right? So if you don't, the problem will get worse and worse and worse until eventually your country will be overthrown, right? Which in this metaphor might mean you're dead, right? Or you're just really, really sick because you've been completely overwhelmed by, infectious forces, or, spike protein or COVID-19 or whatever it is. So a lot of people will take the prednisone for a while, for a month or two, and then taper off of it. They'll go down to 5 and then 0, and then they'll be like, "Oh, I'm fine." But then, and so all the people who have experience with it will be like, "Oh yeah, I cured long COVID." The doctors will say this and the patients, and then they don't follow up, the next 3 months, 6 months, a year when the person gets worse again. So we've seen it in everyone who has. And not everyone, but most people with autoimmune diseases, when you give them a steroid, and we know that autoimmune disease, autoimmunity is one of the things that's happening with long COVID, or at least the appearance. So in this blog post, right? So in this blog post, perhaps a better way of looking at it is that the autoantibodies, or what we think are autoantibodies, are actually antibodies against some sort of bacterial species that's infected you, and not actually antibodies against your own tissues. Although they do look similar, right? Because there's homology there. There's at least similarity between, bacteria, plants, animals. Like we're all made out of the same stuff. So it's not surprising that there would be a lot of similarity between the antibodies that are created against invasive pathogens and our own tissues. So anyway, no one really knows how long it's safe. I mean, we've had people take ivermectin at even higher doses for like a year and even more, even 2 years. And But I would try to taper off as soon as possible. So within 3 to 6 months, and I wouldn't really stay on prednisone. And again, you have to understand that maybe you're not actually helping yourself get rid of your underlying problem, because the symptoms are just a sign that your immune system is activated and destroying things, right? It's rooting out the problem. It's getting rid of spike protein from your cells, and even the monocytes carrying around the little piece of spike protein, it's like they're carrying around a reminder of what the problem is, right? So they can go find it, perhaps, right? Or they've been invaded with the virus and we just haven't discovered it yet. And the virus is creating spike protein inside of them. In which case, they need to be helped, right? You need to help your body root out the invaders, get rid of the invaders from within your immune cells. And you don't need to hold your immune system back. You actually need to support your immune system to do its job. So prednisone is certainly not supporting your immune system to do its job. And I know I used to say this, right, back in the day, that like maybe your immune system's out of control. Maybe it's, it needs to be held back. Maybe that's, but I think my thinking has really evolved on this, that we can't assume that your body's doing the wrong thing. We have to assume that your body's knows what it's doing and it's trying to help you. And what we need to do is we need to try to help it help you by helping to remove the problem that it's fighting against, right? Instead of preventing it from fighting the problem that it's fighting against. So I think that is the right approach.